We've looked at the upper trapezius, we've looked at the sternocleidomastoid, and we've looked at the levator scap. Again, we can look some more at the sternomastoid here because it's off of stretch, and we can just do a pincer technique. That's usually the best technique to do. In terms of where we go next, we're kind of working up is the temporalis muscle. Now, temporalis is a large flat muscle. There are usually 4 trigger points along it. Usually we find that trigger point 2, which is somewhere a little bit further back. It's a little bit near the artery there, so you have to be careful. So bang, I can feel that trigger point there, especially if people are clenching or if there's a lot of tension, anxiety and stress. Again, if we can reproduce their symptoms, that's really, really, really powerful in terms of the therapeutic relationship. So we're going to hold there. Perhaps open your jaw a touch for me. Thanks. Open a little bit the mouth. That's perfect. So we're just taking it off stretch there. Remember, the temporalis muscle comes down and inserts into the mandible. So this is the temporalis somewhere in here, and this is the trigger point. From here, we can then work towards the masseter, and we can work towards the pterygoids as well if we want to. Before they do that, I'm going to come into the orbicularis oculi. Now the oculi here are muscles around the eyes themselves. They're muscles around the eyes themselves, and it's actually really nice to come into. We're going to do a deep stroking massage until we can feel the trigger points, and that should reproduce the headache, and that's really important. And again, what we can actually do is come around the brow itself, and usually there it is. There's a really beautiful trigger point just here. I'm going to hold that. That should reproduce almost like that sinus style headache down there. Perfect. From there, we're going to look now at the masseter muscle. So we can either come from the outside in terms of like the zygomaticus and the masseter muscle, the greater and the lesser, or we can actually do a technique inside the mouth. Now this is a pincer technique, hugely effective. Remember, the masseter muscle, 70 pounds per square inch of pressure. It's the chewing muscle, the clenching muscle, people chewing gum, all sorts of reasons why people get these sort of tension type headaches. Open the mouth for me if you would. What we're going to do is we're going to pop the thumb inside, open a little bit more, thanks, especially people that grind their teeth. We're going to come up and feel the masseter. Close your mouth a little bit, not too much, open it, there it is. So we keep it nice and loose, and we can come in, and I'm using my 4 fingers here, pincer technique. You can feel right on that trigger point there, and we're going to hold it until we feel a change.